Great. And so if I could encourage people in the back to tell everyone that we're about to get started because they do not want to miss Healthgrades. So our first speaker is Eddie Dombrower of Healthgrades. They're located in Denver, and it's quite an exciting story. Eddie?
Thanks. Hi, I'm Eddie Dombrower. I'm the Senior Vice President of New Products and Innovation at Healthgrades. We've been focused on ways to improve healthcare in America and always have been. We've been doing this a long time. Our founders wanted to improve healthcare and quality by empowering healthcare consumers to be consumers. We wanted to provide a transparent view into the quality of doctors and hospitals. So starting there, we put together a team of rocket scientists, statisticians. This was a long time ago. And starting there with medical experts and others to sift through the data that we could find at the time, which was both private and public. We put together a project with the same intensity as the Enigma project and found a way to rate hospitals. We worked to provide lists of the best hospitals and the not so best hospitals. Quality metrics really do make a difference. One of the themes of our efforts over the years is to create platforms, and platforms that really succeed create emergent behaviors. In our case, the first emergent behavior that we experienced was hospitals talking to us and saying things like, thanks, now that you've rated us, how can we let people know about our ratings? And secondly, can you help us if we're not rated so well? So we actually formed teams of doctors and clinicians and went into hospitals, and through our ratings and the other projects that we used, we actually helped hospitals become better at their jobs. And as the web evolved, we also evolved in response to another emergent behavior. So as the web became really the web that we know today, people started using Healthgrades to find doctors online. And so throughout America, people started trying to find doctors online. They used Healthgrades, and they used Healthgrades a lot. And as a matter of fact, in the last year, the last couple of years, we've had over 280 million visitors come to our site to find a doctor. So we are the sort of leading place for people to come online to find doctors. We know all kinds of interesting things about these people. One of the things that we know is that within 7 days, most of those people who come to our site go see a doctor. So we started to change what we did. We provide access to thousands of hospitals and millions of healthcare professionals, but we were always looking for new ways to move forward. As more Americans use our services to find a doctor, we discovered that finding is not just enough. With the increase of data availability, and we started a new commitment to creating a great consumer experience. And all this new data is great, but more data can be a double-edged sword. It's great, but it can also make it easy for consumers to drown in all the minutiae and technical jargon. So our job was to continue to find ways to make the data free, easy to understand and use. So now it was time for us to do something completely different. We want to unleash this data that we've learned how to manage and to process and create ways to make the information easy to understand and profoundly useful. Consumers, that is the people who use our site, can see that there are choices, that there are differences in quality, and that hospitals as well as doctors matter in the choice of healthcare. These consumers, we want to make them have informed decisions and use the tools and information to get to those decisions. And this also helps to transform the industry. Our information, analysis, tools, content, communications facilitation makes our consumers great consumers, which helps themselves as well as the healthcare industry as a whole. So this brings us to what we're doing now, which is Healthgrades 2.0. So I have a freestanding, free-running demo. If there's any of you who want to ask questions at the end of this demo, there's microphones right here in the front. You can come up and ask. So this is a preview of what Healthgrades 2.0 is going to look like. It's releasing now. It's in beta test. And within about 30 days, it will be our brand new site.
A friend of mine recommended Dr. Kevin Swearingen to perform Ted's knee replacement surgery. I need to learn more about this doctor. wow, this not only lets me compare doctors, it gives me the procedures and conditions too. Okay, 232 doctors performed knee replacement surgery. Let's see. Ted injured his knee playing basketball, so I think he'd like a doctor who understands sports medicine, not just knee replacements. Well, that certainly narrows down the list. And a couple of them don't take Ted's insurance. Dr. Carrie Motz looks like a good fit for Ted. Sports medicine, works at a great hospital, and takes both of our insurance plans.
And look, 95% of his patients would recommend him.
Okay, let's take a look at his profile.
Here's his office info, background, offices and hospitals, patient satisfaction, appointments.
Let's see. He's board certified, received an award from Healthgrades. Oh, and this is amazing. This is everything I need right at my fingertips.
I'm liking his credentials. Let's see what else there is. Here's the hospital quality I was just reading about. Look at the ratings for surgery. Pretty good. Okay, I want to see what procedures he performs. Perfect. Looks like he does the exact procedure that Ted needs.
95% of knee replacements are complication-free. That's comforting. And a video on what to expect. I think Ted needs to watch this. Let's see. Common conditions, education and training. Oh, and a background check. Let's see what his patients have to say. Looks like all his patients have been very satisfied with him. He's got high marks overall and appears to be above average in almost every category. His office received high marks too, and the wait times seem really low. I think I'm ready to make an appointment. Request an appointment online. Nice. I know for a fact that Ted's open next Tuesday morning. 10 a.m. should work great for him.
That was so convenient. What's this? It looks like I can see the quality of the hospitals where we might do Ted's surgery. Let's see what's there. Here's everything about the hospital, just like there was everything about the doctor. I wonder what's in their report. It looks pretty important. I didn't realize there was this kind of information available about hospitals, and it's pretty easy to understand. Pinnacle looks like a great hospital with all their Healthgrades awards and high scores for safety and satisfaction. I never realized that choosing the hospital is as important as choosing our doctors. Well, I think we're all set. Oh, look at this. I'm definitely going to have Ted use this guide for his appointment. I came to find a doctor, and Healthgrades made that, and so much more, so easy.
So that's a preview of our new site. It's just launching, as I said. As you can see, we've evolved from being just looking at hospital data and doing things that communicate with doctors and hospitals to being a full-out consumer experience that will help patients find, connect with, and communicate with doctors. If there's any questions, I'm glad to answer them now. It's a small crowd, so it doesn't look like people are rushing to the microphones. Oh, there's someone.
Hi, Jeff Sussman, Booz Allen Hamilton. How concerned are you about sample size for your physicians, especially? I think I noticed there. I know this is, not necessarily a real. It could be real, it might not be. But if you have only a handful of people talking about their experience with a physician, and how representative that is of what the actual quality is for that physician, and also comparisons. I think I saw for the hospitals there was comparison national average. I'm not sure if I saw that for the physician. If there's 95%. No incidence for a physician for a given procedure, but the average is 98%, then all of a sudden that 95% is not as good. So just for those two things, I'm curious to.
Well, I believe that the first question is about the patient satisfaction. Is that what you're talking about with the sample size in particular? Yeah, so we have our own surveys that we do online. We don't do open-ended survey questions. They're, as you saw, they're sort of digital, if you will. We continue to bring those in at a fairly high clip, but they're not very big. We also are beginning to partner with other companies that provide bigger sample sets that have different methodologies that are not online. We think that that's a pretty important thing to, as healthcare reporting evolves, to look at those kinds of methodologies, because in fact the sample size obviously matters in this case. However, people do find it, and people find it useful, and people are begging to get that information. So we're aggressively going out and finding ways to do that. We're working with physicians to get them to encourage their patients to give feedback. So we're cognizant of that, and we're working hard to try and find ways to accomplish that. And in terms of the comparison data, I think was your second question. Right now, obviously, we've been doing this with hospitals for a very long time, and so as part of all the data initiatives that are going on now, we're looking at ways to find good sources of data, things that we can confirm in order to make both a local decision, so how my physician might fare in a regional context, as well as, for example, with oncology, where people are often willing to travel as far as 800 miles to find an oncologist. So they may look at a more national scale. So we're looking at building those things. It's part of my job is to help find ways to present that to consumers in language that they get. And at the same time, the data team, the statisticians, and all those folks are looking at ways to actually get that data in a more robust way. So because we have so many consumers, we feel like we're really well positioned that if we can get that data streaming in and we get people to understand how valuable it is both to the consumer and to themselves as professionals and practitioners, I think we'll see that coming in the next months and years. Hopefully that answered your question. Sure. Anybody else? Okay, then I will pass it back to you guys, and thank you very much.
Introducing the woman, Ms.